someone who's been a guest in this program now on several occasions, Paul Gustafson, who is a clinical hypnotist, also a registered nurse. He's been working as a hypnotist since 2001. Before working as a clinical hypnotist, he worked for 10 years at Mass General Hospital and Hospice. The service that he provides is through burlingtonhypnosis.com. I think if you listen and if you're open-minded, you're going to be amazed by some of the things you learn in the next next hour or two. Paul's website is very simple, burlingtonhypnosis.com, and you can email him at info@burlingtonhypnosis.com. We'll give the phone number and all of that later on during the hour. But first of all, Paul Gustafson, welcome back.
Hey, thanks for having me back, Dan.
Great to see you. It's been a few months since you have been here.
Yeah.
You brought with you a guest and a client. We're going to talk to Julie from Boston.
Sure.
In a few minutes. But so tell us what you do as a clinical hypnotist.
I guide people into deep meditation. And while they're in that receptive level of thought, they can pull in information in terms of suggestions, imagery, metaphors that support change, healthy change in whatever their goal might be. They get recordings of the sessions we do, and I get them engaged in the process of repetition. They come to see me because they've repeated problem patterns long enough that they become imprisoned by them. They can't change. So we use the same approach, and clients are repeating the process of meditative hypnosis so that they can not only release what they don't want, they can plant seeds that support this type of healthy change, and it's a repetition that creates a foundation of relief and success.
Now, you have told me before, frankly, that you cannot cure every problem for every person.
That, of
in
course
some cases, you're very straightforward.
Hypnosis is a great tool to cut the cycle and to create comfort and educate clients to be able to continue creating this comfort.
Now, I know
meditation.
some people are going to listen tonight and they're going to say, come on, I don't believe this. A success rate?
I used to send out satisfaction surveys 6 months after I finished up with each client, and the responses are about 75% were satisfied with their progress, with their success.
It's really all in the mind.
Yeah.
Am I off base with that?
Oh, you're right on the money. I tell my weight loss clients they don't have a pound problem, they have a pattern problem. It's not the weight. The weight's the symptom. What the problem is the pattern of thought, how they think and what they most frequently think about, their relationship with food, and also the impulsivity, making decisions without thought.
Yeah, I mean, I would go to the gym, work out, and then I'd come home and I'd grab a Pepsi and a bag of chips.
You can't outrun unhealthy nutrition.
Yeah, and that's a big part of the program. And you have an opportunity to talk with Paul Gustafson tonight. But I will also warn you that as the hour goes on, it'll be more difficult to get through to the phone lines. We only have 4 lines. Once they fill up, then you're having a tough time. So if you run, you may have to hold on for a few minutes here, but we will get to everyone who takes the time to call in tonight, I promise. Paul has brought with him tonight Julie, who lives in Boston. Julie, welcome.
Thank you, Dan. Nice to be here.
Nice to see you. You look great.
Thank you.
You're a listener to this program.
Yes, I am.
And you're a faithful listener because not only did you find Paul Gustafson, but you also found some help in another program.
Yes, I did. And Dan, I have to thank you because I like the line that you say, you know, these are true stories you might not hear anywhere else. And I thank you for that. You have a lot of talks on politics and current events, but you know, in mid-May, I heard you had nutritionist Mark McCullough on.
Yes.
He's fantastic. I go to see him now. And then on, that was in mid-May. And then on May 31st, I saw a viewing of a documentary called The Connection by Shannon Harvey. I've always heard meditation is important. I was working 20-hour days, and I never had time to breathe. But I didn't understand why. This DVD, The Connection by Shannon Harvey, interviewed experts throughout the world in the benefits of meditation. I instantly bought 10 copies. It made me realize right then and there, I have to meditate now. On June 2nd, you brought Paul on the show. He was talking about phobias, and I said, oh, that's kind of interesting. I had a phobia I was trying to get over, and I called in.
You were afraid of loud noises,
yeah,
right?
yeah.
And thunder and things like that?
Right, exactly.
You called in the show?
I called in. I was your first caller, and I was nervous as heck, but I did it. And I asked Paul if he could help me. He said yes, 3 sessions. That was June 2nd. on June 10th, I came in for my first session. On June 17th, I came in for my second session. After 8 days, I can't tell you the difference. My husband noticed. After one day, we went out to dinner, and I said, do you notice a difference? I said, because I feel like I've had 3 cocktails. I was just very mellow and relaxed, and
And you would have passed the breathalyzer test. Even,
exactly, and cheaper too, 15 minutes.
Yeah.
So after my second session on June 17th, on June 18th, I got the dreaded call at 7:30 in the morning that you hope to never get from my primary care physician, who I'd seen the day before for a routine annual exam. And she says, your white blood cell count is through the roof. I believe you have leukemia, and a oncologist will be calling you later today. Ooh. And it turned out I have CLL, which I'd never heard of before, chronic lymphocytic leukemia. And up until a year and a half ago, there was no treatments whatsoever. You basically had a bone marrow transplant with a 13% risk of fatality, and that was about all you had. So now they have 2 drugs that can delay that dreaded bone marrow transplant, but going to the best hospitals here in Boston, they've said, given my age, a bone marrow transplant is definitely my future.
Julie, let me just first of all say, this is a radio station, so therefore people cannot see you. But I'm blown away. I'm absolutely blown away by what you're telling me, because you look to me to be the picture of health.
Thank you. And again, I have to say thanks to you. Between the nutritionist, I'm eating whole, I'm eating clean, and Paul, I've gone for some sessions with Paul. Once I found out this news, I called him, and I said, we have bigger fish to fry than a phobia. We have to focus on my fear of needles, my fear of procedures, and my fear of what's ahead. And he has been just invaluable. And what I like about what Paul does is he talks to you and he actually listens. So he's writing notes and he talks to you for about a half hour and he writes his notes, and then he makes a customized CD that you take home. It's not some standard thing you find on the internet. It's not someone where you walk in and they start throwing information at you. He really takes the time to listen. He's extremely articulate, and he puts it back in a message that's just fantastic. So I started doing meditation twice a day, and it has saved my life. I was happy. You know, the doctors are very happy to write your prescription for an anti-anxiety pill or a sleep aid or a depression aid, and I take nothing, and I feel fabulous.
Well, you look fabulous.
Thank you.
And you looked, as I said, the picture of health. So you now have leukemia.
Yes.
And when you met Paul in early June, your greatest concern in the world was a fear of noises. Some
right.
people have different fears, and so you were the classic Burlington hypnosis Paul Gustafson client. Paul, what did you think when Julie called you June 18th and told you we have bigger fish to fry?
Well, from my nursing experience working at Mass General, I've certainly helped people in the nursing capacity with extreme situations, health challenges. And having worked in the field of hypnosis, now entering 15 years, I've sat with a lot of people with a lot of problems. So I was very confident that between the two of us, we could put together, I could gather the right information from Julie and give her a tool that she could use. She had already displayed to me through the previous 2 sessions that we'd done that she connected with the process, she valued it, and she was good with it. So we just took it to a deeper level, and I just put together the information that she needed to hear.
She was open to this idea. You're prepared to stick with her for the long run here.
Of course.
Yeah.
Of course, yeah. We've become good pals.
Obvious. It's obvious the chemistry that exists, and her husband is here in the studio with us, so we're not talking about that chemistry. We're talking about a professional chemistry.
Sure.
And do you think that there's some way, somehow, that Julie can outrun this diagnosis?
Well, I don't know. Clearly, I don't. But what I do know is that through meditation, goal-oriented meditation, which is what I refer to as hypnosis, we're able to optimize her ability to do the best she can. We're able to optimize her immune system. You're able to cut that cycle of anticipatory fear, worry, and stress, which is a significant detriment to being balanced and in a position to be as healthy as you can. All of this, and with steady meditation on her part, you're in a much better position to deal.
Julie?
I've actually, in the past 2 months, it's almost like the CLL was my calling for what I'm supposed to do. And I really feel that God gave me this because I'm supposed to do something with it. And I need to share with people the importance of meditation. And I'm a very type A driven, worrywart, the works. And for me, the DVD, that documentary called The Connection by Shannon Harvey, which features some local people, Dr. Herbert Benson from the Benson Henry Mind Body Institute, Sarah Lazar is in it, John Kabat-Zinn from UMass Medical. He's renowned throughout the world for his MBSR, mindfulness-based stress reduction techniques. And I've gone to so many workshops, clinics, CME courses in the past 2 months to learn about this. And the Connection documentary shows 5 people and examples of how meditation or yoga healed them from their ailments. One of the women that I just recently spoke with, a PhD, a doctor, Ann Webster at Benson Henry Mind Body Institute, she has a documentary that she's doing of 5 patients who were told they had 1 month to live. And they're now 20 years in, and they're still alive through her help. So they're doing studies. In the last 15, 20 years, there's thousands of studies, but our medical system is so busy, they don't have time to do that research, or perhaps they're not open to it. But it's out there, and we need to empower ourselves and take it in our own hands. And I love Paul's hypnotherapy because I am so task-oriented that just to sit there and focus on my breath, I wouldn't last a millisecond. But where he's giving concrete, specific visualizations, I'm task-oriented.
You needed a coach.
I needed a coach, and I'm getting something done.
The other thing, too, is when you talk about anticipatory anxiety, I believe that sometimes a little knowledge is a dangerous thing. And obviously, Julie is very intelligent. She understands her situation. She realizes that it's not a good diagnosis that anyone would welcome. Paul Gustafson, Burlington Hypnosis. He's a clinical hypnotist. This is no joke. There have been other folks who have called previously in previous programs who have received great relief from whatever they were dealing with. I think all of us have issues, and that's what Paul does. He helps people with issues. I am a firm believer in what this gentleman does. I've had him as a guest on several occasions. I'm thinking maybe close to a dozen occasions at this point, maybe. All right, let me give out the address and the way people can get in touch with Paul Gustafson, clinical hypnotist. Paul, I'll let you give it out. The easy is the website.
BurlingtonHypnosis.com. The email address is info@BurlingtonHypnosis.com. And the phone number is 888-290-3972.
That's 888-290-3972. He's been a guest on this program, as I said, about a dozen times. I really believe in what he does. Whatever issue or problem is impacting you, Paul will let you know if he'll be able to help. And Julie, I hope that we can follow your case, and I hope that you'll be back with Paul 6 months or a year from now, and feeling as good as you feel right now, despite that diagnosis.
Thank you.
And to both of you, Paul and Julie, and Julie's husband, who's in the studio with us, happy Thanksgiving. Thanks so much for taking the time to come in.
Appreciate it.
All right. We'll be back with a final hour of Nightside coming right up after Dawn Huff and the 11 o'clock news. Stay with us.